delighted to have Jay and really, presenting something that is really important to all of our businesses.
I was with the U.S. Department of Health and Human Services, the Office of Inspector General, where I served as the Assistant Inspector General for Investigations. Really cool job. I had oversight of our Special Investigations Branch, our internal affairs. And that was some really neat stuff that I get to see. But more importantly, it gave me a lot of exposure to healthcare fraud. Who needs to be HIPAA compliant? What is a covered entity? First and foremost is if an organization, practice, or an individual is electronically transmitting health information, even if it's done internally within the organization, and there's no VPN and it's not transmitted outside of the practice of the organization, it's still a standard, you're still considered a covered entity. If you file electronic insurance claims, you are a covered entity. If you file Medicare or Medicaid reimbursement electronically, you are a covered entity. You can't go wrong if you use the privacy rule as the benchmark for your organization. Yeah, are you going to be held to a little bit higher standard? Absolutely. But then we get rid of some of that gray area. When you manage over 90 million patients, I can tell you the risk is going to be pretty high. You have a treasure trove of health information that your organization is maintaining. These plans that I write address all of those implementation specifications, and there's over 50 of them. Now, I don't think this applies to anybody in this room, but I've gone out on consultations in which, believe it or not, I've gotten organizations to admit that they share passwords. I follow the industry. I follow the breaches. If you're ever bored, I know no one in here is ever bored, go on the HHS website, look at the breach notification portal. You would be surprised at the number of breaches of all sizes that are occurring. You have to conduct the risk assessment.